before I start, I would like to thank Dr. Shivani and the college for giving this opportunity, simply because this is a topic which is very close to my heart. And even before we get dive deep into the topic, I want to tell you how I became interested in this. Okay, so 2 years back, Dr. Moshmi had called me to speak on special healthcare needs dentistry. And I was like, yes, ma'am, I would love to speak. I said, I'd love to speak on children with sensory processing disorder and children with neurodiversity. And she said, no, your topic is designing a dental clinic for children with special healthcare needs. I was like taken back for a minute. I was like, this is not something that I really know well. But as things connected, what was happening is I was also setting up my second practice at that point. And the only regret I had with my first practice was that it was not accessible for children with wheelchair. So that was one point that I had kept in mind. कि मेरे next practice में I have to make sure it's wheelchair accessible. But beyond that, I had no idea. But as I started reading up more and more, that's when I came across multisensory environment, or in some of the dental literature, it's called as snoozalon. Okay, it is similar, it's just a patented word. But even before we go into multisensory environment, let's just understand this. We as humans are sensory being. That is that is the basis of everything. We experience our life through our senses, our touch, our vision, so many things that we take it for granted, but then we gain information through all our senses. And even maturation of our nervous system depends on how we are perceiving our environment, how we are getting enough sensory stimulation. So that is why it plays a very important role, at least for the first 6 years of life. And this moment to moment sensory stimulation, that little touch, that little hug, or walking on the sand, is what really affects us even as adults in many ways. It helps us with our motivation, our mood, how we are feeling for the day, and generally the overall well-being. Okay, historically, even if we go way back, Aristotle had told that we gain knowledge through our sensory stimulation. And Maria Montessori is someone I think we all would have heard here and there, right? She is the one who had come up with Montessori way of schooling. So she worked extensively with children, and she said that, actually she was working in a psychiatric ward in a pediatric department. So that's when she realized that a lot of these children were not getting treated simply because they were not getting enough sensory stimulation, or the way that they perceive the environment was different because of their sensory processing disorder. That's when she realized how important the sensory stimulation is for the general well-being of individuals. She said that if a child is with an intellectual disability, which was earlier considered a mental issue, she said it's more of an educational issue. We should change the way our education system works, especially for these children, to make it better for them. Then there are various other people like Cleveland and team who said that, let's say, for example, you and I can walk around, we can touch. So we get enough sensory stimulation on our feet, on our hand. But at the same time, an individual on a wheelchair, just compare it to them. The amount of sensory stimulation they get is very, very less. And also a neurodiverse individual, right? The amount of sensory stimulation they are going to get is either, if we put them in an environment which is similar to what is our day-to-day life, the amount of stimulation that they get could either be too overwhelming for them or too less. So that is why Cleveland and team started designing multisensory cafeterias for people with special healthcare need. That's when Edward Hule came up with the concept of snoozelon, which is actually a multisensory environment which is used purely for leisure purpose by people with special healthcare needs. And that's how that term came into being. So when you come to the actual function, what is multisensory environment? If I had to define it and what are its characteristics, these are the 5 things we have to keep in mind. It is artificially created environment devoted to stimulating all senses or at least 2 or more senses. It has to be safe, of course. It has to be comfortable. It has to be demand free, and it should have or empower through self choice. Now, this is very important when we talk about sensory modified environment in a dental setting. Again, this would become very important that there should be some amount of self choice given to the individual. For a second, let's take a second back and see what all other surfaces we are touching. You might be sitting on a chair, your feet might be touching down, there might be a slow hum of the AC in the room, or the slow hum of my AC you may be able to hear. These are not the things that we recognize easily, right? It is somewhere in the back of our mind. That is simply because of a process called as sensory adaptation. Our brain knows, okay, these are not really important, to put them aside and to focus on things that is important. I am really hoping now, because I can't see clearly, that your brain is telling to focus on what I am talking and it's considering it important. But that is how we work on daily basis. And that is the area where our neurodiverse population, or we may call a child with autism or an adult with autism, have an issue. They cannot do this sensory adaptation as effectively as we do. Before even I go to the next topic, or before even we progress, just imagine if a normal light in the room is painful for you, and it has been painful from the time you were a small child, and you are non-verbal, you're not able to express. Every new thing, every new sound is too loud for you, but no one else feels it. That is how a neurodiverse child is going to feel. And even more in a dental setting. The neurodiversity could be, more on the milder side, but then that's what the child feels. And there is no way of, us understanding how much different is this child's sensory processing issue. So we have to start from there and then go to the behavior management. We have to place ourselves in the child's shoes and see what the child has gone through. Then, of course, sensory stimulation is what we know, what we feel. Walking on a grass, walking on a sand is any day better feeling than walking on cold tiles. It's that simple. That's how sensory stimulation and adaptation basically work. And these are the things that we are going to use to maybe create a sensory adapted environment, or just to make the experience better for children in general. Now, in today's world, application of multisensory environment is kind of diversified, right? Just one second. So it started with its maximum use for people with special healthcare needs, and it continues to be. It was started with hospitals, in hospitals for people with Alzheimer's, dementia. It was started being used multisensory environment in schools for children with autism, or children who had sensory processing disorder. It There are studies which say that it was used in nurse station also, because nurses are considered to have a very stressful job. So what was done was it was used in nurse station for them to use it during their break time and see if it's really helping in reducing their stress, and it was found that it was very useful. Then again, it has been used in hospitals otherwise also for children. And then now we are seeing its application in dental clinics, because there is so much of what to say, a diversified use, right, of multisensory environment. In 2010 annual idea forum, professionals said that they have to set a certain guidelines, so that the benefits of this multisensory environment doesn't get lost in the various ways it is being used. So if you are like really interested, this is something that you should look up, and it's available. The article is available online, the whole article, and it gives you in-depth knowledge about multisensory environment. So when all the professionals met up and they discussed the various application, that's when they came to a conclusion that multisensory environment is extensively beneficial to this group of people. Of course, it was understood that it is beneficial for people with special healthcare needs. It is extremely beneficial for people with sensory processing disorder. We spoke about it. But it is also beneficial for people without disability. For, without disabilities, it is helpful in learning, relaxing, and for people with anxiety. Now you know how we are getting closer and closer to the dental setup, right? It is a very anxiety prone area. So till now, most of the uses have been for children with special healthcare needs, or children and adult with special healthcare needs. But the benefits of multisensory environment or sensory stimulation is a whole lot. It can be easily used for uh, even individuals without any special healthcare needs. There are studies. There is a study in International Journal of Science and Research where they found that it is beneficial for children in reducing anxiety in a dental environment, especially during their first visit. And we are also working with the Savita Dental College, where they have converted their isolation room into a sensory adapted room now, and they're doing a study to see how it is working. Uh, just because I myself am sounding too monotonous to myself, do you have an isolation room in the college?
Ma'am, we do have we also used to have an isolation room in the college, but now we also have changed it to a multi-sensory room. It's been almost a year now.
Oh, wow, that's really nice. When I was studying, isolation room was the most dreaded place to be in for the child and us, actually. But I'm so glad it is changing to something better. That's nice. So yeah, that they've also done that, and they're they the in Savita Dental College, when I was talking to the PG who's doing the study, she was telling me that she's finding that lot of other PGs also come and relax there during their break time, because it helps them manage their anxiety and stress, better. But yeah, so that's good. Going to the next slide. So yes, I am Dr. Premila Naidu. I think ma'am has already given a very elaborate introduction. So we'll just skip to our job as pediatric dentist. So now let's focus on us as pediatric dentists. What does our job involve? Over a period of time, we keep doing it so regularly, we do not understand how important are we, right? Our job involves putting sharp instruments in a child's mouth, in a very small, restless, unpredictable being, right? And the mouth is so small. We have to put sharp instruments there. That's just the beginning. Then we start using high speed drill in that mouth. And we, as pediatric dentists, are the only people who have to make the child sit after we've given them an injection, which already makes them feel super weird. We want a 3-year-old, 4-year-old, 5-year, 6-year, 7-year child at the end of the day. The child has to get an injection, feel super weird, and sit on the dental chair for maybe 15, 20 minutes to an hour till we do the procedure. If I had to compare myself to a pediatrician, they do all their checking. Finally, they'll give one injection, give one chocolate, and send them off. The job ends with an injection. But for us, as pediatric dentists, we start there sometimes, right? But our job is not only this that I mentioned. The most important, not most, but more important part of it is, this is how they imagine us most of the time. But the more important part is we have to make dentistry fun for children, right? There has been years, decades of fear associated with dentistry. It is on us to break that chain. We need to develop a good relationship. We have to make sure the child develops a good relationship with the oral cavity and dental health. We have to make sure the child loves us. We also have to make sure the parents love us, the grandparents love us. If they have a pet, even the pet loves us, because that's the only way they're going to keep coming back to you, right? And we also have to make sure we are working toward child's overall general well-being. So these are the onus on us. And that is why maybe we as pediatric dentists are always looking for things, to make it better, the dental experience for the child. So we do know, it is just common sense that the environment that you are in would affect your whatever the mood in multiple ways. But just for the academic purpose, there are studies also which say that, like there's a study by Heschman which says that, environment is a living dynamic system and it could either hinder or support what you're planning to do. At the same time, Dilani study says that it helps based on the environment that we are in, the way we cope up with stress and anxiety, depends on it. So if you're in a favorable environment, you might be able to cope up with stress, anxiety better. You might be able to come up with better solutions than an environment that is not really conducive. Any day, like if you were in a beach right now, all of us would have been in a better mood. I don't know if we would be listening to each other, but at least the mood might have been better, right? That's basically what it says. Environment plays a significant role in how we feel. So now we bring that logic to dentistry. So most of the studies, initial studies about sensory and adapted dental environment, multisensory environment has been done by Shapiro and colleagues. And they have found that, once you start adjusting the dental environment, that is why it's called a sensory adapted dental environment to the child's liking, then the benefits, the child could be more cooperative. So they were working extensively on children with special healthcare needs, especially neurodiverse children, children with Down syndrome. And they found that once we adjust the sensory simulations in a dental environment, it is much better for the children are more cooperative. But only in 2020 has AAPD mentioned that yes, the sensory adapted environment plays a significant role in relaxation and can help in avert negative behavior from the child. For me, this is a huge achievement because from the time I've been doing PG, which is way back, to now, there has been so many developments in pharmacological management, behavior management of the child, right? From GA to sedation, oral, nasal, spray, whatever. But what have we done different in the non-pharmacological side? That is a question that we have to ask ourselves. There has been no change. We've always spoken about the same tell, show, do, and the same non pharmacological behavior management that's been there. So, this could be a new thing to look at, not only for children with special healthcare needs, but for children in general, as mentioned even in AAPD in 2020. Just a quick check on, just 1 second. Yeah. How does this work? Okay, these are the three ways in which it can help. That is reduction in pain, behavior facilitation, and reduction in anxiety. Let's have a little detailed look at it. So when the child is focusing on a positive stimuli, okay, this is also from Shapiro et al. Study. There is an altered state of mind. The child is a bit relaxed, the child is distracted, and there is reduced awareness of the discomforting stimulus that might come child's way. Next is this. When there is an increased attention to one particular stimulus, let's say the child is fully focused on the fidget toy that you've given or the audio visual aid, then these neurons activities which are involved in this particular stimulus is stimulated. At the same time, the other neurons which are involved is inhibited. And so the focus of that pain or discomfort is not felt as much. Third is similar to what we do even while giving LA. We apply pressure somewhere so that the prick is not felt. It works on the similar principle. When the attention is distracted, processing of the pain signal is reduced.
How well can you focus?
Can you hear it?
Yes, ma'am.
Brilliant.
Out.
How many?
11. 11.
Okay. Let's see what they say.
If you answered 11, congratulations, that's correct.
Right? You all saw the 11 jumps, 10, 11, whatever, right? Now see.
But did you see the gorilla?
How many of you saw the gorilla?
None. You? One of us, ma'am. 2.
Not bad, not bad. So yeah, that is basically how distraction works, right? So to put this example into a dental scenario, we are the gorillas, right? We do not want the child to focus on what we are doing. We want the child to remain distracted. This is what typically a child sees in a dental clinic. Like I'm not telling a pediatric dental clinic. I think most of us are better equipped. But I went to pediatric clinics like the Children's Hospital in Bangalore and their dental clinics. And this is what they typically see. And then we turn on the bright light. And then there is drill sound. If this is not enough, then there is our face with the drill sound. Right? Compared to this is what we can do. Where even if our face is there around the child, there's so many other things the child can see or feel curious about and remain distracted. Okay, so this is how Snozulon principle also works. It is just a patented term given, but it is basically multisensory environment, which was spoken about in 1970. Like I told you, no, Ad Hugel put it up saying that Snozulon is for people with special healthcare needs. So it's a leisure activity so that they get enough stimulation. So they have been talking about way back in time. But if we had to define, it is a multisensory adapted environment. Okay, so there is multisensory stimulation, but the word that we need to focus here is it is adapted. Adapted based on the patient's or individual's need, which is coupled with patient centric therapy. It includes lighting, you can put favorite music, you can have a lead apron if someone likes deep pressure on them. A simple thing like an automated room freshener can play a significant role. So now when we talk about a multi-sensory environment, or if we start, thinking about designing one of the most important area that we start with is the waiting area, because that's where the child might spend quite some time before the child gets to sit in the operatory or get into the dental chair. But the principle remains the same. So wheelchair accessibility is because for the accessibility purpose, but if you have to talk about multisensory environment, you have to remember you have to engage as many senses as possible. Visual is what we always mostly focus about, but we have to try and engage all the senses. So visual, try to have dim light than typical white hospital lights. It's better to have warm lights than, again, white lights. Soothing music is always helpful, or any distractive music is helpful. If it is in the operatory, you can ask the child the songs they like and play that. Anything tactile, like wherever our feet touches, is something that plays a very important role, though we do not realize it. So a warm carpet, artificial grass, or what we've used is a rubber flooring, that blue thing that you see there. It's epidemium flooring. It feels like sand, basically. It has that cushion. So that helps. Then, of course, your interior, your aromatherapy, and any day cooler environment feels better. One more important thing for kids waiting area is, anyone, what would really help?
Games.
Simple play therapy. Give them broken toys, give them normal toys, they'll break it and keep, but they will be engaged. It's also a place where I see my neurodiverse, neurotypical, all the children having a good time together. Kids are inherently curious. All we have to do is provide distraction, they will move towards it. And the same principle of multisensory environment is followed, can be followed even in the operatory. Like have lights that can be adjusted. We can have, bright white light, then blue light or very less light based on child's preference. Remember, the first thing that we spoke about when we spoke about fundamentals of multisensory environment is there should be some degree of self choice. Otherwise, we are missing the whole point. I might have a very very beautifully done interior, but if there is no option of self choice there for my child or my patient, then we are losing out on the battle. You can ask the child how they would like the light, dim, bright, and let them select, like let them select the music, let them select their cartoon they want to play, and give them the self choice. That would really help with the overall behavior management of the child. Mm. We don't have to do the whole interior. Like I said, it was just the right time that Maushmi ma'am gave me this topic and I was doing up the clinic so I could match it up. But if we already have a practice, we can always create a small sensory corner, or change the isolation room into a multisensory environment like you've done. I think most of the things are easily available over Amazon. I think the only thing required is the change in thought process, where we give equal importance to pharmacological and non-pharmacological behavior management. This is mentioned in some books where they have a separate calming room. This is again very helpful for neurodiverse children, someone who doesn't like to be in crowded space. We can create a room for them where they can unwind. If they're getting overwhelmed, stay there, calm themselves down before the treatment. These are some examples. What we have done is we've kept that option in our operatory itself. So we block the time accordingly. So a child, if they want, they can sit. We close the room door, watch their thing, and maybe we start the procedure after some time. So throughout the presentation, basically what we are trying to achieve is not that it's well known that multisensory environment really helps children with neurodiversity. But the point is, multisensory environment or sensory adapted dental environment is actually beneficial for everyone, every child. And of course, it is beneficial for our children with special healthcare needs. Then why shouldn't we do it? Like when we first started having this conversation with my designer, and she was like, but how many neurodiverse children are you going to have in the clinic? Why you want to do that just for that small population? Firstly, that small population is important simply because we don't know literally how many children are there with sensory processing disorder. We do not have a clear number, and that is something that gets easily missed. So we don't know what the number is. And secondly, it is beneficial for all the children. Then why not, give it a try? Just, I would like to end with this small video about Maria Montessori and why, it is important to keep this in our mind.
Married in those days. She was very eloquent and that she could speak very convincingly. She was particularly interested in the psychiatric department. She found that there were children, we were there, locked up in a big ward. The nurse said, oh God, they eat crumbs from the floor, they have no manners. And Maria Montessori said, no, they have nothing to do. They need sensory stimulation.
Similar to what a child has to do on a dental chair, right? They have nothing to do. So if we want the child to, of course, behave better, manage their anxiety better, I think we should give them something to keep distracted. In conclusion, like I said, we started with the benefits in special healthcare need individuals. Then we came to the benefits in hospitals and dental clinic. But I think it has got a much larger scope, simply because nowadays, because of so much of building, so much of industrialization, the houses are becoming small, and we are just kids are spending more and more time indoor. There is reduced free time, reduced space for exploration. Kids are visiting to hospitals, much more often than what it used to be earlier. And we are the ones who keep telling children, stay here, don't go there, sit in one place, do this, do that. Considering all this, it is time for us to, stop changing our children for the world that we are creating. It is, better we start changing our world for the children than doing it vice versa, right? So our responsibility as adults, pediatric dentists, as a community is to let kids remain kids. Thank you very much for this opportunity again. And if anyone has any questions, I'm here.
Any questions, anyone? Yes, ma'am, we do have a question.
Yes, please.
Good afternoon, ma'am. Good afternoon, ma'am. I'm a first year PG student. Thank you so much for a wonderful presentation, ma'am. I have a question in mind. Ma'am, for the children with visual or hearing impairment, what are the extra changes or any requirements that you can make to feel them less anxious and more comfortable?
Children who are visually impaired.
Yes, ma'am. And audio as well.
Yeah, so visually impaired and children with hearing impairment, the same things would work better, right? When you work on multisensory, you are giving them tactile stimulation. You are giving them fragments that does not, make them associate it with the hospital. So apart from, of course, visual, if they are able to see, if they're partially impaired, they will really appreciate dim light, because it doesn't suddenly brighten or doesn't hurt their eye, but the other stimulations will be more beneficial for them to explore and be distracted. So I don't think you have to make any additional changes. If you really provide a multisensory environment, that will work for them also.
Thank you, ma'am.
Most welcome.
Ma'am, we have another question.
Sure.
Good afternoon, ma'am. Ma'am, like we talked about sensory adaptation, so there have been times I've come across some children who tend to feel a little claustrophobic and very agitated once they enter into the environment. However, we have to calm them down and then they adapt to the same. So, if we come across patients who are unable to adapt to such an environment or feeling claustrophobic, is there any different way of directing such patients?
Claustrophobic to what? Sensory adapted environment or a regular operatory?
No, no, ma'am. In a sensory adapted environment, since the lights are dim and there is a very limited exposure to the environmental noises, so the children.
Again, here you're missing the point. Sensory adapted doesn't mean always dim light. Sensory adapted means you adapt to the child's liking. If the child feels claustrophobic in a dim light, you should have an option of brightening it. Right? That's what I told you. You should empower the child by giving self-choice. So sensory adapted is not always dim light.
Okay, thank you so much, ma'am. Thank you.
Ma'am, I do have a question. Have you ever worked with the nitrous along with the sensory adapted dental environment?
Yes, I
Okay.
have. So one of the operatory is fully sensory adapted, the one I showed in the video. So that has nitrous.
Okay. So does it have a better effect on the individual, or there's some kind of choice of patients which you do select for taking up patients with SAD as an adjunct to nitrous?
Nitrous, we use it as per the child's requirement, but I don't know if it has an additional benefit, like SAID and nitrous together, if you're asking me.
Yes, ma'am.
So, okay, fine. Let me rephrase what I am thinking your question is. You are asking me if SAID and nitrous together is better than nitrous alone.
Nitrous alone or SAID alone, any of these. So basically, either of them act as an adjunct to the any of these used alone.
So I don't know. I don't know because what we do is like I said, my operatory is sensory adapted. So I treat all the children there.
Mhm.
And when I feel that, maybe for this particular child, nitrous would be an added benefit, then we use nitrous for them. So I have not done a comparison, or I have not got the opportunity to compare them in 3 different environment. But one thing I feel is maybe the amount of nitrous we use in a sensory adapted environment is lesser. Like the same child, if I treat in my other clinic, I might have to go up to say 30-40%. But in my sensory adapted, maybe 10-20 would still be enough.
Right. Any more questions? It was indeed a pleasure listening to to you, ma'am, as always. And it was same this way today also, though we were all hungry, and it was not a good time to have a webinar planned, but then also each of us enjoyed a lot all through your lecture. Thank you
Thanks
so
so
much.
much. Yeah, I know during PG, during academics, how important lunch break is. Thank you so much for your time. And Doc, if you have time, I would really like to see how your isolation room looks now. Just
Yeah,
curiosity, and if it's okay with you.
actually, we are in a different building, ma'am, but definitely I'll share pictures and videos of our sensory adapted room with you.
Yeah, that's what I meant. Yes, yes.
Yes, ma'am. I'll surely do that. Thank you so much, ma'am. Thank you. And we'll just, this is your e-certificate, ma'am, on the screen. And is it visible to you?
No, it's not. I think you will have to share the screen. Yeah, now I can see it.
Thank you so much, ma'am. And I'll be mailing it to you as well. Thank you, ma'am.
Thank you. Thank you so much.
Okay.